to let any other folks come in. But in the meantime, if you need to grab something quick, but we'll be starting in the next 2 minutes. Thank you. Just another minute, and then we'll start. All right, we can actually go ahead and get it all started. So good afternoon, everyone. Thank you for joining today. My name is Tracy Previlon, and I'm actually an architectural drafter here at Build Health International, BHI for short, and I will be your moderator. This week actually marks Women in Construction Week, and it is an important opportunity it's a week, it's basically from March 1st to 7th this year, and it's a week that helps celebrate and elevate the contribution of women across the architecture, engineering, construction industries. It is a moment to reflect on the progress that has been made while continuing the conversation about the work that is still needed to ensure that women are supported, represented, and empowered. Here at BHI, the conversation is especially meaningful because so much of our work sits at the intersection of healthcare, design, and construction, and those sectors directly impact the well-being of communities around the world. Before we begin, just a couple of housekeeping notes. First, the webinar is being recorded, so we will be sharing the recording afterward for everyone that would like to revisit the conversation or share with colleagues. And we also will have a Q&A session towards the end. So if you are having any questions as we go, please go ahead and add them to the Q&A box, and we'll address as many as we can after discussion. So, without further ado, let's get it started. So who we are, Build Health International, again, BHI for short. We'll be using BHI probably most of the meeting, considering Build Health International is quite a long name. For those who may not be familiar with our organization, what we are a design build nonprofit, and we deliver high quality, dignified healthcare infrastructure and low resource setting around the world. So how we started, the organization basically started after the 2010 earthquake in Haiti. Side note, I am from Haiti, I'm Haitian. So this actually, strikes right from home. And basically, when after the earthquake, BHI collaborated with partners in health and Dr. Paul Farmer and to construct the Hôpital Université du Mirabalais. We like to call it HUM. It's basically a 300 bed national teaching hospital. And boy, since then have grown. BHI ever since has completed over 250 projects across 70 low and middle income countries, working in partnership with nonprofit organizations as well as local governments. At the core of our mission, the belief we have is health equity, the idea that every person deserves access to safe, dignified, and reliable healthcare facilities. Beyond architecture, engineering and construction, BHI also focuses on training and equipping local workforces, ensuring that the knowledge and capacity built through each project stays within the communities we serve. Without further ado, if you didn't know much of BHI, then there you got it. To start off, and without context, I'd actually like to invite our panelists to briefly introduce ourselves. If you could please share your name, your title, and I will let it go to my dear colleagues. I
Hi.
actually will call Allison, so.
Thanks, Tracy. Hi, everyone. I'm Allison Adamson, and I'm an architect at BHI.
Good afternoon, everyone. My name is Alexandra Best. I'm a construction project manager at BHI.
Hi, everybody. My name is Sola Da Silva, and I'm an architect at BHI.
Hi everyone, I'm Sarah Godschall and I'm also a project manager at BHI.
Thank you. Now that we have the name of everybody, of the women that we all work together with at BHI, let's start off. I want to start off simple, kind of like a foundational question a little bit, just to go on with the theme is, um, you know, how should construction and design projects address and account for women's health need, considering BHI's work? Again, I'm sorry, Allison, but I'll call you off first on that.
No problem. Thanks, Tracy. So I think first we have to understand what those health needs are through conversation and discussion. And even before that, I think we need to acknowledge that we may not be experts in women's health, especially if we're not experiencing it or addressing it every day. And also acknowledge that women's health needs vary by location and culture, demographic, and age. So once we acknowledge that, we can come in with an open mindset and ready to learn from these conversations and discussions. So BHI works all around the world, and we know that these health needs vary project to project and country to country. I can speak a little bit about my experience working on the design for the Maternal Center of Excellence in Sierra Leone. This is located in Kono, Sierra Leone, very rural region. We're just wrapping up construction now, and the birthing center is seeing its first patients and first babies being born just last month. And design started many years ago, and before that, research started for many years with site visits and conversations with the clinical team, and especially the maternal and reproductive director there, Asata Demboya, where we talked about the country's history and how that's led to some of the high maternal mortality, what the leading causes of death were in this space, and also women's feelings towards receiving health care at a hospital and how that's delayed women coming until it's absolutely necessary. So through talking through all those challenges that the country's been seeing, we were also able to identify what the design can look like, that will resemble that, a comfortable feeling, make women feel welcome and valued when they're in the space. So when they walk in, they say, yes, I know I will be respected here and will receive high quality healthcare here. So that's just one example, but it's the mindset of coming in with research through site visits and conversations with the building's clinicians, operators, and patients is one we use with all of our projects.
Yeah, Allison, I'll just jump off of what you said. And I always appreciate your input from the design side. And for those of our participants who haven't seen the Maternal Center of Excellence, I highly recommend looking it up because it truly is a wonderful feat for women's healthcare. When I hear this question as a construction project manager, I take the perspective of how can we account for women's health needs on construction sites. And a lot of times that is forgotten. And a very simple example that I constantly think of is a lot of times on construction sites, there isn't a place to dispose of feminine hygiene products. And this is something so small and simple, right? It's a closed waste bin, but it makes such a big impact in a woman's experience on a construction site. And so I would encourage everyone when we're thinking about how we set up temporary facilities for construction sites that we're thinking of even the small but simple things like this that make such a big impact in a woman's experience at work.
Yeah, Alex, that's well put. It's kind of the little things that we're not thinking about. And if I can just jump on and add to that, I think at the end of the day, it's about money, where we put our money and our time, right? Like globally, we know how much is being spent on women's health. And as architects and designers, we are kind of feeding off of whatever funding is available. So I think as designers and architects, what we can do for women's health is to essentially advocate for more funding, advocate for more projects, whether that's in our own little ways, and to people in the audience as well, like depending on your sphere of influence, thinking about how much money is going into female women's projects, women's health, but also from a design perspective as an architect, it's also thinking about things like what Alex mentioned, like washrooms, what kind of things do women need in their own spaces, whether it's safety, whether it's access to a private space that's not easily accessible by other people, privacy. So I think we are impacted by the general ways that the industry deals with women in terms of funding, in terms of healthcare, and in our own little ways, when we see those gaps, we can certainly advocate for that. Yeah.
Yeah, 100% Sola. I think for me, when I hear this question, I think about representation and like the slogan of this webinar, built by women for women, making sure that there's space at the table for women in all aspects of the project, stemming from the decision makers from conception through execution. And it's important, especially in our work, that it's not just any woman. Like my healthcare needs as a woman who lives in the US is going to be very different than the patient in Sierra Leone, and making sure we're being really intentional about that cultural component. And then, making space in other parts of the project, making a construction site a safe place for a woman to work, a design team, a place where a woman can feel heard and share her ideas. So, I think like having women involved in every stage of the project makes a really big difference in making sure that those needs are met and that the project is executed in a way that keeps the end user in mind through the whole thing.
Thank you, Sarah. I like how you mentioned that basically we also need to account for kind of like the cultural differences depending on the different locations and like how it's treated in the US versus other locations. And I actually like to transition to kind of like a question more broadly about the industry itself and like how is the construction industry different in other locations compared to the US? Given that construction is still largely male dominated. What has been your experience like working in different environments? Alexandra, I'll actually catch you on this one.
Perfect. Um, I was just going to say, from my experience, I've worked on construction sites in the United States and also in Sierra Leone. And my experience in the United States has been primarily male-dominated construction sites. And then I went to Sierra Leone for the first time, stepped foot on a construction site, and majority of the workforce was women, which is something I'd never seen before. And it was really exciting and really beautiful. And I see the rest of the world in the construction industry moving in that direction. And it's really encouraging to see what that could potentially look like everywhere else one day.
So I would like to hear your input on that.
Yeah, I mean, I think the way I think about this is that architecture, like our industry, is not really removed from, just general, the social, like just society in general, right? And globally, yes, it is male dominated. And that's been my experience. I don't go to site as often. I typically more doing stuff in the office, but my experience has been that it's been male dominated. But I think that I would just kind of urge us to reflect on how architecture cannot be and construction cannot be removed from how we treat women in general. So if we're seeing a pattern in just globally, then we're going to see that as well in our work. We might have cases that are a little bit different here and there, and those are to be celebrated, like Alex's example. And I really love that example. And we should definitely find ways to build on those, very specific situations that we find. But the main experience is the main experience, and that's why we're having this conversation today. Thank you.
Yeah, like you said, Sola, it's so cool, but so rare to see a construction site that has so many women on it. Right now, I work with our construction team, but before that, I had started off with engineering and then our oxygen and biomedical teams. And as part of my role on our oxygen team, I was supporting our capacity building programs and training programs, one of which was actually in Sierra Leone, where Alex referenced that job site. In the cohort of 30 people in our training program, there was only one woman, and she seemed really disengaged the first day. But after some one-on-one time, I learned that this was her first day on her first job ever, and she didn't have any biomedical background. So she and I would stay after sessions and do some extra work to build that foundation. And by the end, she was ready to jump into her new job. So I guess the takeaway from that story is just that there are a lot of fields where women might be the minority around the world, and it is possible to change that. Like you can see it on our job sites at MCOE and Koidu Government Hospital and the Dormer campus where I work down the street from there. But it requires a lot of effort and intentional staffing and support and meeting people where they are with the background and the opportunities that they've had to date. So thank you.
I 100% agree, Sarah. And I think with that effort, I guess a lot of times we think it's more difficult than it could be, or we make it a little bit more difficult than it should be. And with that being said, when we actually do have women in construction, finally, what do you think that women in construction need in order to advance in their working careers? Okay, we got women there, or we're still working that, but then what do we need at that point? And actually, so I actually really want to hear what you have to say about that, given your last answer.
Yeah. Well, no, because I think I'm just itching to say money, right? Like we need to put is it put your money where your mouth is? Money, right? Like funding for mentorship, funding for women taking exams, funding for education, for programs, right? Like for women's research, cancer research, cervical research, cervical cancer, like, the list goes on, right? So I think as a society, we've kind of used money as a way to signify value. That's how we show things that we value, is what we spend money on. So we need to spend more money on it. That's the first step, at least in my opinion. I know that there's other things, and I'm going to pass it on to the rest of the panel to jump in on that.
Yeah, so you touched on one thing, mentorship, which I think is so important to have someone that looks like you and you can go to that person for advice and is in your corner. I think beyond that, it's having a whole team that sees your value and sees your potential and is willing to give you opportunities to challenge yourself and learn and make a few mistakes and allow you to explore and excel in what you're passionate about. And then also a team that's approachable so you can have those more difficult conversations with them. And you also feel like empowered to voice your perspective, even if it's a little bit different from everyone else's.
I'm just going to jump off of what you just said, Allison, because feeling empowered to use your voice kind of goes along with my immediate thought for this. And it's a very cliche answer, but I really do think to be successful, you need to be yourself. And I say this because when I first joined the industry, I felt like I had to act and approach situations like my colleagues that were men, because that's who I was surrounded by. And I thought if I adapted to their style, that's what would allow me to succeed. But I realized that by not being myself, I was actually putting myself at a disadvantage because I wasn't able to form real working relationships. And at some point, I just got really tired of it and I realized it was making my life harder. And once I fully embraced being myself in the workplace and addressing situations like how I think is the best way to address them, I found I found that it was much easier for me to succeed. And um, I think I started to see that being a woman in this industry isn't a weakness, or something I have to hide. It's a strength. And because of that, I will always stick to my advice of being yourself.
I appreciate that so much, Alex, because us as women, a lot of times we may feel like we have to walk on eggshells in a lot of ways, and kind of like we never feel that like we can be ourselves properly to be successful. And I think that's the perfect occasion to ask kind of like, what does success look for us as women? Basically, kind of like what type of support that like in our experience have helped along the way or that could help along the way. And Sarah, I'd like to hear what you have to say about that.
Sorry, slow to my unmute button. 100%. And I think that I found a lot of opportunity in mentorship and support, but not in the traditional ways at BHI. You know, the reality is that in an industry that is minority women, you might not always have access to a mentor that is a woman and is on your path. But I've been really lucky to build a support network in other ways and lean on my peers, and find someone like Alex who I can learn from and with, and who can remind me that it is important to be myself in this job, and that it's okay that my methods might be different than the project manager that came before me. So, I think success to me is finding a way to make it work and build that community and lift each other up to grow together, because, construction at least is a team sport. So leaning into that has really made a difference for me. So shout out, Alex.
Want to touch on the role model aspect. I think, well, first, I think success is going to look different for all of us because we're all unique. But for me, it looked like when I realized I might be starting to become this role model in this space. I haven't spent a ton of time on our sites in Sierra Leone, but the few times I was there, I've been honored to build friendships with the women building these hospitals and facilities. They're a really inspirational group who a lot haven't worked on a construction site before, so this is their first time learning a trade and being on site, and many have become leaders around the site. So feel lucky to have built friendships with them through reviewing drawings and measurements and photos, both on the site and on WhatsApp. And one of them gave me a wedding present a few years ago, and I think that meant just as much, if not more, to me than a college degree or the passing check mark on an ARE exam, because it signified that maybe I am becoming this support system for women starting out their career that's so needed in this space.
Allison, I'm just going to jump off of that because I mean, from you saying it feels like being successful in the workplace is you becoming a role model, and Sarah, you saying seeing other women and being able to work with other women also helps with your success. I think in general, representation of women in the workplace is so critical to success. And I say this because I remember my first day on a construction site. I was so intimidated because my manager and I were the only women on the job site. And walking into that environment felt really overwhelming at first. But watching my manager be herself and be so respected, confident, I mean, she was an absolute powerhouse of a leader. And it completely changed my perspective. And seeing a woman ahead of me be so successful in the industry is what made me believe that I could be too. And I really do believe that's why representation matters. And we talk about it a lot, but in practice, it means a lot.
So I don't know if you have anything you want to say.
I mean, everybody has said just really amazing points. I think the relationships that we build in our work is very important, and it's what's gonna, be the catalyst for our collective and individual success along the way. I don't think we can get very far without each other. So, yeah.
I agree. And Alex, I think you said it best of like we talk a lot about inclusion all the time. It's not just about, because this is Women in Construction Week that we're talking about it. It happens often. That's not the issue. The it's more about like making sure that we constantly uplift and we constantly actually apply this in a real life, setting. And because of that, even although we do talk about it often, do you think that there is a gap between intention and action? And if there is one, what can organizations do to close that gap? And Allison, especially after your story, I actually want to hear what you have to say.
This is a big question, but and a tough one, but an important one. I think having conversations like this is certainly a start. We need to address the issue and talk about it as a starting point, and including everyone at the table because it is a big issue and we need everyone's brains to solve it. And once we're here, coming with an open mindset to willing to create some change and open to having more difficult conversations because it can be a little uncomfortable. Um, it's one point. A second idea might be, creating equal opportunities at every level of your career. I know at BHI there's amazing, strong managers who are women. There's project managers on this call who are women who are going out and leading teams on site. And then we have architects and designers, meeting with partners and presenting drawings. So I think at BHI we have really diverse teams that's, really attractive to everyone and making us all feel welcome to share ideas and um, do what we want, do what we feel passionate about.
I mean, I can jump in here if nobody else. I think this is where the conversation, as Allison said, gets a little bit difficult, because I think intention is always there, but at the end of the day, sometimes there's a difference between intention and impact, right? I think we're all pretty good at spotting blatant things that go wrong when it comes to the dynamic between men and women in the office or on the construction site or wherever we are. Those types of incidences are pretty clear. It's more of the subtle things and the unconscious biases that show up in the day to day that we all have to kind of deconstruct in our minds, and women and men included, right? Because we were all raised in the same social setting with the same social rules, and there are ways and systems that have been in place for a very, very long time in the workplace, just even in groups, how we interact with each other. So I think that that's kind of, in my experience, where that gap continues to show up is in the more subtle spaces. And this is where maybe sometimes women end up doing a lot of the emotional labor, right? Like understanding that, okay, maybe that was a well-intentioned um, thought, but it didn't land the way it was supposed to land or whatever. And I think as somebody, I'm not going to say who, but she is always talking about how men also have to be as equally strong advocates for women as because sometimes women won't be in the room, right? We won't be there to speak up, and men need to start being allies. It's the allyship, right? Like them also taking on that mantle and saying, okay, I know there's no woman in the room right now, but that's not a good joke or whatever, like also them doing that work for us, because it gets tiring for us too to be the ones setting up these meetings, to be the ones doing all of these things. So having that partnership, I think, is very key. And this isn't to say that men are not doing it. I know that there are lots of men and people who identify as men in the attendee list. So yeah, but just in response to the question, that's where my mind goes. So thank you.
Yeah, for sure, Sola. And I feel like it's a big question and there's no one simple solution, but the day-to-day things can make such a big difference. Um, a simple thing that I've experienced is like just the act of giving everyone a voice and taking seriously what they say. I've been really lucky to have managers and mentors that were men, but were open to hearing and adapting to the way that I might need different support or work differently. Recently, I had some travel challenges that I was really nervous to share, and had to advocate for myself and the other women who had been traveling, and was really happy that they were taken seriously so that like I could do my job and go, to the job site. So I think just like women to advocate for themselves and those who don't identify as a woman advocating anyway, can make a really big difference.
Thank you, Sarah. And it does make a big difference, both parties involved or all parties involved to be part of the conversation. And I think, speaking of like, I guess I'm curious to know kind of like the opportunities for women entering or growing within the industry, right? It's kind of like what kind of professional educational support that are available for women working in a built environment. As far as my experiences go, there's plenty. Sometimes we don't even know that there's plenty, but at the same time, there's plenty, there's also not enough, you know? So like there's a lot of professional networks out there that are available for women in general, outside of like our day-to-day work, outside of just our like finding our mentors. There's organizations like Autodesk, AGC, Massachusetts, Professional Women in Construction, as big in NOMA, like AIA, that offers opportunities and not like panels, but also mentorship. Opportunities to women, like I think the most recent one, the most impactful one I went recently, not even the most impactful, one of the most impactful ones I found was about, I guess, a couple of years ago in Boston. AIA had a conference, I think it was called Women in Leadership summit, where I was surrounded by amazing women, and just like my whole perspective in construction completely changed in the way I felt empowered as it was. And I was not just alone as a woman in color in general. So I guess it's like these little things that may seem kind of like, okay, it's like a professional event. No, they're more than that. More often than not, the connection you make in these situations, it's just amazing as it is. And, it's taking advantage of that when we know them and when we know they exist, but also kind of like letting our other colleagues that don't know about them, letting them know, dragging them to said events. Like, you don't want to go, then you don't have a choice. Let's go. It's kind of like that situation of making sure we have that. And that's just been my experience, especially coming off after undergrad and also having that because in undergrad, I think Sola mentioned it before, it could be a surprise when you leave undergrad where there are more opportunities to feel connected and represented, and then you're landed in the workforce, it's completely different. So like I really appreciate how you mentioned that because especially for people coming off of college, it could be kind of like a surprise for women. And that's just my experience. So I'd actually like to hear if Sola, you have any idea about that and like any opinions about that.
Okay. I think the support I have had in my career has come from both men and women. And I've had to learn to look at what each what both people have to offer in the way that they communicate in the type of advice. And one person will get you in a certain way and be able to transfer that knowledge to you in a certain way, and also learning the nuances between the two. And it wasn't always consistent. Like sometimes I didn't have anybody that looked like me or could, in my opinion, relate with me. I think also just speaking generally, more intersectionalities a person has, whether it's Blackness or queerness or being an immigrant or having a certain ability or disability, that adds to the layer of maybe perhaps otherness that a person can feel in a setting, or experience in a setting. But I think whenever you find those people, just hold on to them, like don't let them go. Just be like, you're going to teach me everything you know. And I know like I have at BHI, our bosses know I'm on them. Like, Jay and Gerard, I'm always like, teach me, because yeah, that's you just kind of have to stick to somebody and say, you're gonna teach me what you know, and you're gonna help me grow in my career. And sometimes you have to be forceful, and not forceful, but you kind of have to say, yeah, I need this mentorship, and sometimes that's the way to do it. And sometimes you're the only one and you just bumble through it and that's it. Yeah, I don't know. That's my 2 cents.
Oh, it's really good advice, Sola, because it can be hard to put yourself out there and search for those opportunities. You might not, you might even feel like, oh, I don't need them. But there are a lot of groups out there that are targeted at just this very thing. I was lucky to go to a conference a few years ago with another colleague from BHI, very specifically for women in construction, and it was just like overwhelming and so cool to see how many different roles women are playing in this space too, and how many different paths you can take, and the paths that people took to get there. So I think even just being exposed to the other work that people are doing and the different things that you can do in that industry is enough to kind of you know, provide mentorship, find a new mentor, keep you motivated. So
Tracy, I like what you said earlier about dragging somebody to an event because it can be so scary to show up to an event where you know no one and everyone feels like you know each other, and there's so much potential at networking events and professional organizations, but it's the hardest part is always getting your foot in the door. And Sola talked a lot about earlier about the monetary issue. It's expensive to go to conference and present at them, and be a part of professional organizations. So it's again helpful to have a team that doesn't have to support you financially, but really pushes you to get over the hard part, whether it's putting in your credit card information or signing up for the event knowing you might not know anyone else there. So I think it goes all back to having the support system to kind of encourage you to do that.
Thank you so much, Allison, and thank you all, wonderful women, my colleagues, just so great. And I think one thing to remember is that this conversation is never ending. I don't think until we know it just grows and evolves, and the conversation also switches depending on where we are, what point in our professional lives are we in general, and it gets even more complex when we add construction in itself. And I think there's so much to talk about and think about. But actually, I'd be curious to know if there's any questions from the audience, if anything has come up of like where we could hear from the audience. Um, but if without further ado, let's see. I'll start off with Beth Gary, asking, how does having women in construction on many Build Health International sites, such as the Maternal Center of Excellence, we call it MCOE all the time, improve the care of women who are being at BHI healthcare facilities? I don't know who wants to hop on this question first.
Can speak a little bit to that. Just from firsthand, I've seen how passionate this team is about the work that they're doing, providing like just a little bit more care. They're coming in early, they're working 12-hour days, they're coming on the weekends when they have kids to take care of and other jobs to do. They care so much about this project because they know it's impacting their community. Um, and I think that just shows in the work that their precision, their commitment, um, is seen in every corner of the building because they know that they're the ones seeing the impact.
100%, Allison. And I think that in resource constrained areas, like education around healthcare, can also be a big challenge. So having community members, especially those who may then go on to get care at these facilities, be a part of the project allows them to learn more about it, share that with their other community members, family, friends. And then, in the case of the maternal center, when the doors open, like everyone's ready. They know exactly what it's about. So I think it makes a big difference to have them be a part of the process. And then after the facility is completed, it's a trained workforce in the area for other construction projects that are going to happen afterwards, which is another really, really big gap as far as high quality healthcare infrastructure.
Right. I was just going to say that, Sarah, that what's so cool about the construction workforce now is they're being trained at the Maternal Center of Excellence, but they're gaining skills that then they can carry after this to continue to grow in the industry. And something else I'll add is at the Maternal Center of Excellence, there is a garden dedicated to the workforce that the workforce has helped put together, and it just It really pushes the idea that these women are coming to build a place where they will receive care one day. And there's something really beautiful and powerful about that.
Thank you, Alex. I'd like to ask the next question. For those who don't work directly in AEC, what meaningful actions can we take to support women in the industry?
Donate fun things.
Very true. I think in general, always find like outlets to help and donate. I think for example, we also on our website, buildhealthinternational.org/donate, I believe. There's also a big donate button as well where we can continue the work we've been doing and kind of like also help create advocacy for that. So that's one place to start, just putting that out there. But also in general, it's just also kind of like staying informed and staying kind of like up to date in the sense of like continuing these conversations. The same way you showed up for like this event right now, it's the same way show up for the next one. You know, it doesn't have to be just for women in construction. It's just in general. And one way or another, you are connected to a woman that is in this industry, either directly or indirectly. It's kind of like starting from that as well. So I guess it's literally that. It's just finding out, donating around, looking out, and I'm reaching out.
I'm just going to add, Tracy, to yours that our work intersects so many other sectors. We've talked a lot about healthcare sector today, but there's so much else too that our work touches. So I think, you know, again, being willing to have these open conversations so we can learn, so everyone can learn, and like push improvement for everybody too.
Yes, 100% agreed, Allison. I think our next question is, as women build the future of healthcare spaces globally, how can we not only excel in design and construction, but also reshape the culture of the AEC industry so that women's leadership, creativity, and expertise are the standard and not the exception? Beautiful question, by the way.
I think the first thing that comes to mind for me is like storytelling and celebrating, telling the story of the women that are contributing and the roles they're playing on these projects so that, other women can see it and be motivated to do the same. Other organizations can see it and think, oh, that's a great idea. So really just spreading the word about the work.
I'm going to go back to my first point here too, and the importance of making sure the infrastructure of both the organization and the actual workplace is set up for women to succeed. Because if there's not a place for women to succeed, they can't grow to become leaders. So again, going back to, is there a proper place to dispose of my feminine hygiene products? Is there a nursing room so I can be a mother and still show up to work? If you don't have those things, it's going to be really hard to be successful and to grow.
I agree. And in so many different ways and in so many different levels. And speaking of different levels, this, I guess looking back at our experience at BHI and the work we've done, how either of you guys think that we can involve local clinicians and communities in shaping the design so the facility truly reflects how care is delivered locally?
I mean, I think that, oh, Allison, I see that
Go ahead.
you, okay. I think that this starts even, very early on in the design process, right? Before even drawing a sketch or anything like that, is having those conversations with the community. And I will say that we do a pretty good job of doing that in our projects. We'll typically have a site workshop where we will meet with people in the community. And I know Allison and others can speak to various examples where we've done that. And even the MCOE example of people being part of, builders is just that idea of community involvement. But I also understand a little bit from the question that it's clear that not everybody who is working on that project lives there, and there are things that we probably don't know. And I think that that is part of the work that we continually have to do, which is looking for those gaps. What is it that I'm not thinking of that is important? How can I get those perspectives? And I think sometimes, we're also at the behest of of funders, or I mean, not funders, but like money, the financial economic system, right? So sometimes that adds more pressure to the process. But I think just raising that awareness and seeing how we can do more of what we're already doing, I think is the first step. Yeah, I hope that answers the question.
It definitely touched upon it, Sola.
Um,
Thank you so much. I think then I guess the other question could be directed towards kind of like the educational portion. Before we all get into the field, we also all have to go through school of some sorts. So like, or not, but still. I guess my next question is actually from Beth, and it's talking about how do we think education, architecture school, basically can do more to support future women in design and construction. And I actually will ask the question also in tandem with a question directed towards being a student is kind of like what can we do from now to be successful in a way, like what to focus on in order to like build a pathway for us. I don't know who wants to jump on that one.
think one quick thing while I formulate more of an answer is getting out of the classroom when you're in school. So you're exposed to different fields within the AEC space, and then seeing a diverse group of people working there is one thing to, let your mind run wild of what's possible. And I think that also goes back to, finding your network and support system, and figuring out what you're really passionate about too.
I agree, Allison. I think especially that's really worthwhile to know when you're a student, and kind of like working with that mindset as well. I think that will help like greatly for the development. Um, Gerard actually asked, it would be interested to know specifically if there are other professions or industries that one can learn from regarding mentorship, career development, opportunities, etc. That's a good one because let's say if we're a background in architecture, you may think that your only kind of like segue is towards architecture mentorship, but that's not necessarily true, but that's my opinion. I'd like to know if you guys have a different opinion. I will call out Sarah.
I think to go back to what you said, Tracy, like there are groups, there are to network, build your community, build your network, are really good ways to start. And I think the more you're out there, the more you'll find, the more you'll hear about things that others did that you could mirror or kind of twist into to fit into your own career path. So I think just having these conversations and don't stay inside your box, inside your comfort zone, get out there, hear what others are doing, and it will open doors.
Thank you so much, Sarah. I think probably this has to be our last question considering the time, but I have a question from James. And how do you see striking a balance between training and developing women who are new or less privileged connected to the AEC world versus costs and resources, which are also limited for BHI's work? I'm not implying that women are less qualified, more especially on African and Haitian job sites, there are so much less opportunities for women and many more barriers. I struggle with thinking about this balance, not just with women, but also the balance between developing local resources, versus expats. Anyone wants to jump on that?
I have some thoughts, and I'll try to make it very quick. I think rethinking how we define like education and curriculum, and I think a lot of people already have skills that they use every day locally, right? There's a lot of knowledge, but a lot of that knowledge has not been standardized, or it hasn't been, I would say, tied into the Western education system that a lot of countries have now inherited in some of the countries that we're working. So I think finding ways to help, let's say, a person who's done certain things on site take their practical experience and weave that into a formal system will help them get into that like streamline, because it's either that they're just handy, like they know how to do things with their hands, but it doesn't transfer into a certificate or a degree that they can use in terms of like the Western education system. So it's how can we identify what those gaps are in their knowledge set and build on that and formalize it in a certain way. I don't know, that's what comes to mind. So counting prior experience and building on it.
I would also add, Sola, that it doesn't happen overnight. Like this is a really hard question and a really big challenge that we face. And I think starting somewhere and figuring out the different ways that people learn, what's going to stick, how can you most effectively build capacity? And then as you do that, it gets incrementally larger and easier as you then have the expats training other expats, you have the women training other women in a way that is makes sense with their prior experience, and then all of a sudden you blink and it's a few years later and you have a whole workforce of skilled people who are teaching those around them, and your new student becomes the mentor or like the leader of the crew. So starting somewhere and taking it at the pace that you can afford to, but even the smallest bit does make a big difference from what I've seen.
Thank you so much, Sarah. Unfortunately, we are running low on times, and honestly, this type of conversation could really go forever. But I would like to thank all of my panelists, my dear colleagues, for kind of like giving out their input and sharing their experiences, and perspectives today. And thank you for everyone here that joined us and had basically lunch with us, joining this conversation in recognition of Women in Construction Week. They're incredibly important, not only for highlighting the challenges and women face in the industry, but also celebrating the progress. There has been progress. We're not where we want to be yet, but there has been progress. And we want to make sure that the progress is continued and made so that the community can support us women in the industry. We also want to make sure that us both at BHI, but in general, everyone joining this call, we want to make sure that these type of conversations don't stay within Women in Construction Week, and that it's a more broad conversation had all year round, 10 years ago around. Hopefully, at some point, we don't need to be as loud about it anymore because it wouldn't be a problem anymore. But until then, we want to make sure that everyone knows that this is an ongoing conversation in general. If you would like to know more about Build Health International, and basically the work we're doing all over the world. I'd like everyone to basically visit buildhealthinternational.org. You'll find different goodies there, such as the projects we have been working on, the donate button, the donate button as well, but also like our annual report in general, what we've done along the years, and also probably see some of us here in certain blogs or certain posts or just in general. Um, Without further ado, I'd really like and on behalf of VHI, thank you everyone for their time. And we really truly do hope that this was only like a little inch of the conversation that needs to be had continuously. And thank you so much. If there's nothing else, I'd like everyone is free to go. Enjoy the last what, like 8 minutes of lunchtime. But thank you very much for having this.
Thank you,
Thanks,
everybody.
Thank you,
everyone. Thanks for
everyone.
joining.
Bye. Thank you.
Bye.